What if there were medications that could control your immune system just enough to stop joint damage, but still keep you safe? Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today, we're talking about a big topic in modern rheumatology, biologic medications. These medications have completely changed how we treat autoimmune diseases like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, and more. But what exactly are biologics? Are they safe? And when do you need them? Let's break it all down so it's simple, understandable, and helpful, especially if you or someone you love is living with an autoimmune condition. Let's start with the basics. Biologic medications are specialized drugs made from living cells. That's different from most other medications, which are made from chemicals. Biologics are designed to target specific parts of your immune system that are causing problems, usually from an overactive immune system or miscommunication in the immune system. In rheumatology, biologic medications help to control diseases where the immune system is attacking your joints, tendons, skin, even your spine or other organs. These are conditions like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, lupus, and vasculitis. Instead of suppressing your entire immune system, biologics are laser focused. They turn off the part of your immune system causing the damage, but keep the rest of your immune system intact. Why are biologics used? It's a great question. If you have an autoimmune condition that is moderate to severely active, biologics may be the most effective option to prevent long-term joint damage, reduce inflammation quickly, improve pain and stiffness, prevent disability as well. They're not necessarily the first treatment for every patient, but when used properly, they can save joints, organs, and overall quality of life. So how do biologic medications work? There are different types of biologics. Each is targeting something slightly different. Let's go through the main classes you may hear about at this time. The first are TNF inhibitors. Examples include Humira, Enbrel, Remicade, Simponi, Cimzia. They block tumor necrosis factor, or TNF, a major inflammatory signal in the body. You'll see this used for rheumatoid arthritis, psoriatic arthritis, psoriasis, and ankylosing spondylitis. The second are interleukin-6 inhibitors. An example would be Actemra. They block another key inflammatory signal, interleukin-6, helpful in rheumatoid arthritis and giant cell arteritis. Next, you've got B-cell inhibitors. An example would be Rituxan. They target B cells that create antibodies that attack your joints. The next are T-cell modulators. An example would be Orencia. They stop your T cells from activating the immune system inappropriately. And then you've got interleukin-17 and interleukin-23 inhibitors. Examples include Cosentyx, Stelara, Tremfya. These are commonly used in psoriasis and psoriatic arthritis. So when should biologics be started? This is one of the most important decisions we make in rheumatology. Biologics are usually not the first step unless your disease is severe at diagnosis. We generally follow a stepwise approach. First, we confirm your diagnosis and check your labs, imaging, and joint exam. Next, we may try lower intensity options first, such as oral medications like methotrexate, Areva, sulfasalazine, or hydroxychloroquine, plus add on exercise, diet, and supplements. If those don't work, or if your inflammation is already aggressive, we move on to biologics. If you have evidence of joint damage or very high inflammatory markers, or your disease is interfering with life, we don't want to wait, because every month of uncontrolled inflammation increases your risk of permanent joint damage. Are biologics safe? This is the number one question people ask me. The answer, yes, with monitoring by your physician. Biologics are actually very safe when used correctly. They've been around for over 25 years. We check labs regularly to make sure your immune system stays strong. We screen for infections like tuberculosis or hepatitis before starting. And with experience, we know how to use them intelligently and with shared decision making. Some people worry that biologics are too strong, but often they are more targeted and safer than long-term steroid usage, which can cause bone thinning, blood sugar issues, and more. Can you avoid biologic treatments? Sometimes yes. If your disease is on the mild side, or if you catch it very early, you might respond well to an anti-inflammatory diet, omega-3s, turmeric supplementation, and low-dose oral medications that still work on the immune system, but maybe not quite as strong as the biologics. But if you have moderate to severe disease, or if you have persistent symptoms despite trying conservative treatments, biologics may be your best option. And the goal is not to be on them forever. Some patients can achieve remission and eventually lower their dose or switch off. In my practice, I also specialize in regenerative medicine, using your body's own healing tools like platelet-rich plasma and bone marrow cells. Here's where I see regenerative medicine shining. Tendon or joint damage that is not from an autoimmune cause, let's say osteoarthritis or degenerative tendon issues, pain after joint inflammation has been controlled, muscle and ligament instability. But if your pain is from active systemic inflammation, biologics are what controls the fire. Then we can rebuild the damage using regenerative tools once the fire is out. Some common myths about biologics, let's clear up a few of them. Myth number one, they're like chemotherapy. The truth is that while some are infused like chemotherapy, the mechanism is very different. These target immune proteins, not your whole body. Myth number two, you'll get every infection. The truth is that the risk of serious infection is slightly higher, but very manageable with monitoring and precautions. Myth number three, you'll be on them for life. The truth is, there is a chance you will be on treatment long-term. Autoimmune conditions are chronic, and typically chronic treatment is needed. But for some people, they can reduce their dosage over time or even stop if they reach remission. It's a partnership decision between you and your physician. Biologic medications have revolutionized rheumatology care. They're not for everyone, but for people with moderate to severe autoimmune disease, they can prevent joint destruction, restore function, and dramatically improve quality of life. As with all treatments, it's about finding the right approach for your individual situation and teaming up with a physician who understands your condition and knows how to treat you in the best way possible. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and living healthy. You can also follow us on our social media channels. And if you're looking for personalized non-surgical care, give us a call or contact us via our website or social media channels. See you next time, and live well.